So today we have somewhat busy agenda, but hopefully useful. We will begin with a review period as we usually do, and that means you can ask me anything related to public health or life in general, and hope we will have time to talk a little bit about the final assignment for the quarter. We're now week 5, and it's time to begin to think about that. And then at about 2 o'clock, we'll have a visitor, Ms. Dyan, who's the manager for Work, Life, and Wellness program at UC Irvine, and some of you work with her. After her presentation, we do what we usually do, which is to think about the core issues and cross-cutting themes regarding work, life, and wellness, what she essentially presented. So what's today's date?
May 1st.
What does that mean? What's May Day? International Workers' Day. Where it's May Day means different things to different people internationally, but for most countries, it's we all get a day off. In the U.S., we don't care about workers. You just work until you collapse. But yes, this is a day that in most parts of the world, it's to celebrate labor. And I almost came late today because I was at the first workshop that the Office of Academic Personnel for Faculty would hold on doing something about mental health on our campus. And some of the quotations that I got out of it was pretty disturbing, actually, in terms of how little we pay attention to mental health, not only on our campus, but it's a national problem. If any one of you has ever taken a course in the global burden of disease, neuropsychiatric conditions have the biggest burden of any of the chronic diseases that we worry about. And typically, this is hidden in our communities. Up to 22.6% of all people between the ages of 18 and 25-year-old in this country, at least, have some form of mental health concerns. More than 18% of all Americans suffer from anxiety disorder. And this is not about anxiety, that's about clothing or where to live or what to buy, what to eat. It's mostly about work. And included in that work is going to school. At UC Irvine, of about 1,000 students surveyed, 30% said that they have some experience, some kind of mental health issue. 30% have considered suicide. 8% have actually attempted suicide, and 4% have been hospitalized for it. We have in California Proposition 3 that earmarked money that taxpayers put aside for mental health issues. And UC Irvine now has $6.3 million of that funds to implement mental health intervention and prevention programs. And this workshop that I just attended is the first in a series, and I'm sure they'll be having programs for students as well. But for public health, the biggest challenge for us is that we really don't know how to prevent mental health issues. We typically wait till it manifests, either in behavior, action, thoughts, and then we try to cure it. And there also we have very little weapons in our arsenal. So I'd like to ask you, as part of our review process, Labor Day, Workers' Day, we're having a guest presentation from somebody who works at the Human Resources Wellness Program. what, in your opinion, has public health discovered, whether through research, through practice, that helps prevent mental health problems? What do we do for prevention? Okay, let me ask you this. Let's put things in perspective. What do we do to prevent infectious diseases? What does public health, what weapons do we have in our arsenal to prevent, let's say, the flu or malaria? Vaccines. It comes to you right away. What do we do to prevent some chronic diseases like diabetes? What can you do to prevent diabetes? She said behavior modification. What kind of behavior?
Exercise.
Diet, exercise, it works. Low sugar diets, for example. What do we do to prevent heart conditions, which is another major disease body? Heart attacks, stroke, cardiovascular disease. Public health is about prevention, population. What would you say if somebody were interviewing you for a job? How would you implement prevention for cardiovascular disease in a population? Just take a wild guess. What would you recommend for a population that suffers from a lot of heart conditions? Yeah.
What I said before, and also look at their stress level.
Exactly. It's the same thing. Diet, exercise, particularly exercise is effective for reducing high blood pressure, but also medication. I mean, medication is not outside of public health scope. If somebody were to be diagnosed early and they're on medication, they can certainly push episodes of cardiovascular disease back in time. But she also mentioned stress reduction, which is something that we build into society. How do you minimize stress in the workplace or at school? It takes a more comprehensive interdisciplinary approach than simply saying, stop worrying, right? But you also need to know that some of the risk factors for cardiovascular disease is smoking. I mean, you should think more broadly about these things, and it should come to the tips of your tongues. So the first thing you do as a public health professional is they ask you about cardiovascular disease in a population, you ask about prevalence of smoking, right? So if I say immediately, how do you prevent lung cancer, you would probably immediately say, stop smoking. But smoking is related not just to lung cancer, but also to cardiovascular disease and stuff. How do you prevent asthma, respiratory diseases in a population? What would you recommend? Yes? Cleaner air, absolutely. And that kind of intervention may be policy related, right? So it's not just tablets or vaccines or behavior. You may have to say, okay, the incidence of respiratory diseases in this population is associated with urban pollution, air pollution. So the first thing you want to do is to see how can we reduce that level of pollution, meaning that cars have to use better fuels. You have to build roads and expressways and freeways away from where people live, which means you have to do a little bit of urban planning and land use management to make sure that you cover all the grounds in terms of prevention. These are all the things that public health entails. How do you prevent spinal bifida in a population? How many people know what that is? Okay. Tell us.
Oh, it's for the neural tube. Doesn't develop properly.
I don't think Sean can hear you in there.
Oh, so when some of the neural tube, when you're embryo zygote, it doesn't develop properly. So when the baby is born, there's a problem with the back and the spinal cord.
It's deformed, right? Did you have, yeah.
When she focus on consuming food with high in
Folic acid,
so
okay?
legumes and greens.
Yes, legumes and greens. And we put folic acid actually in all kinds of foods, like breads. So if you buy bread, we decided that it's not effective to just be telling everybody you have to, have some folic acid. So if you read the ingredients on any bread you buy, you'd always find folic acid in it. Most of us don't even think about it anymore, but that was a major public health intervention. So the rates of spinal bifida in American populations decline rapidly. So sometimes we use, such additives in food. Okay. How do you prevent dental caries? Fluoride in where? Or toothpaste?
Yeah.
Yeah. We all do it, we take it for granted. Because public health intervention and research said this works, and so we give it to everybody. So, back to my original question. How do you prevent depression, neuropsychiatric conditions, mental health diseases? People are not they're trying not to meet my eyes. Only to call on you. But the fact that you can't even come up with something, doesn't that say a lot? You could, yeah.
Well, I have mental health. I have a problem with diagnosing. Because if you go to one doctor, you might diagnose you with one disorder. And you go to another person, another disorder, it's also over that. So,
Right.
Presented, how can you give a treatment?
Right. So that's a very important point, which is what she called the social definition of the disease. In most cases, neuropsychiatric conditions are very difficult to diagnose, and the kind of behavior that may be acceptable in some societies and communities may be considered, wacky or out of the norm in other societies. However, psychiatry has also come a long way, and there are certain diseases that are clearly recognizable. Clinical depression has very precise definition, and clinicians can diagnose it. So are things like schizophrenia. A lot of the newer recognized conditions that are relatively mild, attention deficit disorder, those things are very difficult to diagnose, and you always have parents seeking second opinion because they feel it's still emerging. Suicide ideation is not vague. People know exactly what happens. Traumatic stress syndrome is not vague. It's very easily diagnosable. And yet we have very little to offer in terms of prevention. A lot of people will take medication to cure. But prevention is also what public health has to offer all diseases, is that even when we're a little bit vague on the diagnosis, we always recommend screening. That's a huge prevention strategy. If I had asked you, how do you prevent breast cancer? What's the biggest strategy we have to reduce mortality from breast cancer? Yeah. Screening. Yeah. So the range of options available to public health sometimes kind of flies over our head because we're not thinking about how effective some of these things are. The early detection of breast cancer is the best treatment. If you catch it early, you're going to be able to deal with it, and people live a lot longer. And what public health has to offer is screening. The same thing with mental illness. We don't screen enough. We don't ask the questions. Because, why don't we do that? Why is it easy to do it for breast cancer and not for mental health? Well, there are tests. You could do tests for whether you're suffering from depression or post-traumatic.
It's not as objective criteria for what costs.
As in, when you see a lump, sure, that's breast cancer. You can do biological tests, right? But people do brain scans, MRI. I mean, if you have schizophrenia, they can diagnose it pretty quickly. Stigma. There's a big stigma with mental health that used to be with breast cancer too, but we've gone past it. But now it's very difficult for anybody to go asking or to be doing, random screening of mental health issues because there's a social stigma. It's not biological. It has no basis in. It's a cultural thing, okay? Because we just want to distance ourselves from somebody who may be diagnosed with some disease that we don't understand, and typically doesn't kill people, but it's just a huge stigma, and it's not just in Western culture, it's in many, many other cultures. So I encourage you to think broadly about public health intervention programs. Part of our review, one of the things that we talked about last week was how to do persuasive communication. And we talked about certain principles of persuasive communication. Who wants to remind us what we said? Sorry? She can't hear you. I can hear you. Speak up. Pathos. What does that mean?
Using people's emotional sympathy.
Mm-hmm. Appealing to their, what you think they'd like to hear or know about. Okay? It's the same root as pathology, but it's used in a different way. Okay? What else? That's not the only principle. Ego. Ethos.
Author establishes their credibility.
Yeah. Who are you to be talking to us about this? What do you know? So, you have to have some knowledge to have a place to stand to say something. What else? Yeah.
Logos.
Logos. What is
so
that?
like using statistics or scientific findings or resources.
Yeah. Information, the knowledge. So you can easily see how if any of those three don't work, if they're not part of the equation, it's not as convincing. You don't want to hear about the diagnosis of schizophrenia from somebody who didn't go to medical school. Yeah? Even if they did, you sometimes want to know what school they went to and how long have they been practicing. Okay. How many people know the DSM manual? It's a diagnostic manual for psychiatric conditions, and there's a lot of clout if a disease is going to be recognized by psychiatrists or not. If it's not in the DSM manual, people tend to have doubts, and sometimes there are diseases, as they did in this latest version of the manual, to remove certain conditions that were typically associated with autistic syndrome. Asperger's syndrome is no longer in the manual, and it pisses some people off, but a lot of people think that's a relief because the increases in diagnosis of autism that we're seeing is probably a relaxation of the diagnosis standards. And so they remove that because it looks so much like the other kinds of diseases. And it takes almost 10 years to come up with a new edition of the DSM manual, because it's a collection of the knowledge of all of the practicing psychiatrists from all over the country, all over the world sometimes. They put this together in the logos, right? So not only do they have the authority of having training and experience, they also collect their knowledge. Okay? Why should anybody care about autism or some mental health issue? It's a pathos. The statistics that the epidemiological data that I started this discussion with, in terms of how many, if I say 30% of UCI student population have mental health issues, you begin your writing with that statement, it's a clear indication that you want somebody to take a look and what's going on here. Okay. It connects to a current event, a serious situation, something that everybody should at least want to get to the bottom of and see if you can do anything about it. Okay. It's a winning strategy. Whether you're giving a talk, you're writing an essay, think about connect. Usually you begin with the pathos and the title. Okay? So I always emphasize, make your title pull somebody in. And then, you've done your research, you know what you're talking about, and demonstrate that helps you see better than the reader. All right, so this strategy is not new. It's been kind of coming around over many centuries. Beginning, I'm sure it goes farther than Aristotle, but in terms of writing it down in a systematic way, we trace things back to Mr. Aristotle. So what was his 5-point plan in writing well? If you have it, you can read it out. It's not that you should memorize it. What's Aristotle's 5-point plan of effective communication? Yeah, you.
Deliver a story or statement that arouses the audience's interest.
Pathos. Yeah,
Pose
great.
a problem or question that has to be solved or answered.
Why are there? So, okay. Sorry, read the fourth one again.
Deliver a story or statement that arouses the audience's interest.
Mental health on Labor Day, right? Okay, second one.
Pose a problem or question that has to be solved or answered.
Why are 18% of UCI students attempting suicide?
Offer a solution to the problem you raised.
They are too stressed. We should not have finals.
Describe specific benefits for adopting the course of action set forth in the solution.
UCI will have the top ranking on happiest student populations, US News and World Report rankings.
State a call to action.
Let's do it now. Today. So those are also very good guidance. You can pick any topic and kind of see how you might write around those 5 points to demonstrate action. In an example giving for the 5th one, if you've seen, you may think that this is just old Greek strategy, but when you buy a product, those people who market these products to you follow these kinds of plans. Okay, if you want to go back and look at how Steve Jobs used to market Apple, he almost always ends with the plan of action. Go out and buy one. Okay, it works. Why should you be interested in this product? What can it do for you? What are the alternatives? It's like something you've never seen before. It generates interest and it moves you forward. Okay, are there other questions? Any questions? Okay, this is the 5-point plan that you just read. All right, so I wanted to figure out how you've been thinking about the scholarly reviews. I sent out the guidelines. The draft is what we're currently working on now, and the goal is to have you write about a topic with the understanding of the core and cross-cutting themes in public health. And we've used several examples to illustrate those kinds of core issues. So I'd like to hear from Andrew, if Andrew is here. Andrew is not here. Okay. So write that down. Anybody else working for the Earth Resource? Okay, let's go to Kevin. Is Kevin here? Yes. So what did you, I know you have you submitted it?
I'm sorry?
Have you submitted your abstract?
Not yet.
Not yet, it's due tomorrow. So what are you thinking of?
Well, I think one of the big problems at the matches is they always talk about how they're trying to reach out to minorities to get them registered in the bone marrow or the bone marrow registry. Mm-hmm. So I was trying to look at it in terms of talking about why minorities have been so hard to find. So talking about social economic status. Talking about different methods they've used in terms of using paper registry forms versus online stuff. Mm-hmm. Using more just information technology stuff. That's kind of something we're trying to.
So do you have a title? I mean, from what you described, I can easily imagine the title. But what would it? Just give us a working title, not that it has to be your final title.
I haven't really thought of it.
Okay. Why is it? So bone marrow donation is usually matched based on some trait, right? Mm-hmm. Not based on ethnic categories, right? So why is it important for minorities to?
Well, it has to do a little bit with ethnic background too. Uh-huh. So I mean, they're saying they have they're still looking for a lot of minorities like Asians, Hispanics, and just because of the fact, I think they said 80% of the registry is Caucasian. Mm-hmm. That when somebody of Asian background needs a match, they have a smaller pool to choose from.
Because there are certain traits that are shared among certain ethnic groups, yeah. Which means they won't be able to accept marrow from somebody else. Okay, so that's let's think about your full article, your full draft, the scholarly review. So in terms of let's begin with the epidemiological issues. Okay, what did you find out? I know you're gonna do this, but let's do it now actually. So what is the condition for which somebody would need a bone marrow transplant?
So I think this is where I've been getting because I've been going back and forth on this because originally I was just trying to make my scholarly review just for the article more about why it's been such a struggle for the registry to reach out to minorities. Mm-hmm. But I've been thinking because I've been having trouble finding articles, I just need to switch to some disease like leukemia, which is
but it's all related. You don't need to switch anything. That's why we're doing this in class. It's both an example for the others and also to help you. So leukemia, you just mentioned the disease. So the first thing is you find an article on the epidemiology of leukemia. Okay? So you could find, for example, that leukemia prevalence in a particular minority group, let's say Asians, since you brought that up, is different from the incidence of the prevalence of leukemia in Caucasians, right? I mean, it's easy to find those kinds of epidemiological data, right? Did you find some, or you haven't looked?
A little bit.
Okay, so you can put in the numbers. Okay? Over the last year or so, what was the prevalence of leukemia? You can narrow down to a particular age group. You can even put a table. Okay? You can look in these papers and find tables and say, here is the national prevalence of leukemia broken down by ethnic categories. Right? I'm sure if we do Google Scholar, we'll find exactly that data. All right, so that's the epidemiology and statistics of it. Okay, here's the incidence in this population size. Maybe it's disproportional, maybe it's disproportionately high in the Asian population, African American. that's why we need those because that sets off what you're writing about, why it's so important. So let's think about the environmental health topics. What would you think is the relationship between environmental health and leukemia and bone marrow transplant? And ethnicity and all of those things.
I was just thinking more about the conditions people live in, access to resources and stuff.
Mm-hmm. And why would access to a resource, so you're thinking more of the social environment, why would that affect whether or not they're able to?
Well, because if they have poor access to, say, like healthcare, or just, in general, just knowledge about leukemia, then you're not going to be able to realize that they're in need of bone marrow transplants.
Okay. That's a legitimate way to look at the environmental health issues. It may be because they live in places where there are fewer hospitals where they can go to donate. That might be one, social environment issue. They're not economically viable to take time off to go do the donation. But based on what you find out from the epidemiology, that is, you may find that certain populations are more likely to have higher rates of leukemia, then you can think about some of the causes of leukemia. What do we know about the causes of leukemia?
I haven't really looked at it.
Okay, so when you look, you'll find that exposure to toxic chemicals is one of the key causes of leukemia. For example, benzene, right? So if you were asked to predict what populations were more likely to suffer from leukemia, meaning that they would more likely need bone marrow transplant, then you could easily tie it to environmental exposures, typically based on occupation. So if you work in low-paying jobs that you're mixing chemicals all day, you're using paint, you work in the shipyard, those are places where, or dry cleaning facilities, those are the kinds of places where the environmental conditions may predispose somebody to leukemia. So you could take what about the social and behavioral aspects? I think your thinking already kind of revealed your emphasis on that area, because part of the socioeconomic conditions, the ethnic differences in donation are all, maybe some people don't like to go donating. There are some religions where they don't accept blood or marrow or donate those things because it's against their culture, religion. You can also talk about that. What about the policy and management, the health policy and management? What would you think?
With that, I was just going to try talking about just the use of online registry options,
Mm-hmm.
Social media and stuff like that, to really just get information out.
Right. So that's very helpful. So let's now think about the cross-cutting themes. I asked you to pick 4 out of 8, right? 7 or 8. Based on our discussion so far, we've already talked about certain cross-cutting themes. So someone want to say out loud what all of the cross-cutting themes are? Or let's start with you. Which ones were you thinking about?
I was thinking communication and informatics.
Mm-hmm. Communication and informatics. It's precisely what you just described. Getting the information to people who may be willing donors, they may not know about this. How to organize that information to match with the recipients and the registry. What else?
I was just thinking professionalism, diversity, culture, and ethic issues.
How does that play a role?
I was just thinking, because if we go back to like social economic status, just being able to relate to people maybe like lower incomes,
Mm-hmm.
and maybe people who are just higher incomes, because you have to get the broad spectrum of people to register.
All right, it's an interesting angle. And then, did you?
Diversity, culture, and ethic
Right.
issues. Kind of what you talked about earlier about certain religions.
Yeah.
Maybe opposed to that.
Yeah. And if you let's say you had picked 2 ethnic groups, Asians need but the most donors are Caucasians. Okay, you can really just find articles that focus on, these cultural issues in the Asian communities, about, communicating to them, about donating some of the biological basis that may inform why, you need bone marrow from somebody in the same ethnic category as you. You may go into that in terms of the biological basis of the disease. All right? Okay, so I hope that's a good example. So remind us again what the March registry is all about. Bone marrow, or they do blood and organs and everything else?
Bone marrow.
Just bone marrow, very focused. So I think whatever you find will actually be very useful for the organization, actually. Okay. Joanna? Yes.
Yeah.
So you see the example. So now tell us the abstract and how you think it.
I'm actually waiting on the abstract until I finish the
Understood?
whole
Yeah,
paper.
this is the draft. Yeah.
Yes. And I am focusing my scholarly review on development delay in toddlers. I kind of want to start off basically saying how environment really affects if a child will go through a development delay, because most of the articles I have found really relate the environment with the toddler, since a home environment especially is very important, how a toddler is progressing with like all the learnings and stuff that they need to go through. Epidemiology was kind of a tough one because I really didn't know how to find incidence and prevalence, and I didn't know
All right,
whether
you
I
have to better define developmental disability. Right? So what the Childhood Center does is the education of children, and sometimes special education is warranted because they're not progressing as quickly as the others, so they have a different kind of learning curve. So you can either focus on one particular type of developmental disability, okay? In which case it will be very easy to find epidemiological data.
Yeah, I've been finding like articles on ADHD.
Okay, so sometimes that may not be your key interest, but you have the data. Okay, so you would use it as an example. So, for example, among the developmental disabilities, ADHD, the trend is increasing over the last 10 years or so, partly because of diagnosis, but also partly because we think there's something going on that is still under investigation. But there are numbers about the prevalence. I think something about 1 in 5 children are affected. What else? So.
And for social and behavioral, I was focusing on the risk factors that are causing or relating to development delay. So a lot of the early actions, or that they are demonstrating or not demonstrating early on. So that's kind of what I had for social behavioral. And then for health policy, I was looking at the World Health Organization. They actually had a good review on just generally what they want to see in schools.
How to implement intervention or prevention. What about this thing that boys are more likely to be affected than girls? Have you found anything
I
about
actually haven't seen that, but I did see that definitely adopted children, especially coming from international countries, coming into America, will definitely experience development delay. So that was interesting.
That would be very interesting. Okay. And you talked about environment?
Yes, environment was the home,
The-
and then
the
also
social
social
environment.
welfare
Yeah.
systems that could also affect their delay.
All right. And then cross-cutting issues.
The only one that I really looked at or focused on was diversity and ethnic issues, because depending on their social economic status, that would greatly affect their home environment and their overall surroundings. So that was one that I'm looking at for sure.
Or you have to?
Yeah, I know, I thought that before, but.
Okay, so what is the best intervention now that you know to help autistic children or children with attention? Actually, let me put it this way. What is the symptom that's exhibited by children with developmental disabilities such as attention deficit disorder?
One of the risk factors was if they were considered as late talkers. So if they
Communication.
were, yeah,
Yeah,
I guess
that's
that-
a huge
okay.
cross-cutting theme in this category of diseases. In fact, if you look at what you do at this school, at this center, I bet a lot of it is how to communicate more, how to teach these children to communicate better and how you communicate with them so that they're not frustrated. You want to hold their attention, right? So communication is a huge part of this, I would imagine. That's just two.
I don't know, those were the only ones that
What about the biological issues?
I guess.
Do you know, you're hesitant to go look into the genetics of autism? Does it run in families, for example?
I was kind of just looking overall,
Or ADHD?
a general overlook on development delay. I didn't really focus on one particular.
Yeah, it might be easier, it probably will be easier for you if you can still do generally developmental disabilities, but if you're looking for examples to give in these categories, it might be better to look at specific cases, diseases, or conditions. So it would be a lot easier for you to find information on the biological. Something is very funny in that email she's writing. In that, in terms of attention deficit disorder, one of the studies that we did a long time ago was to look at the relationship between the exposure to manganese and lead, and we took teeth from children under the age of 8. We had about 300 of them. We ground the teeth up and we looked for different metals in the teeth. And we found that there's a strong correlation between those who had high levels of manganese and lead and attention deficit disorder, the various conditions. We also found that those who had deficiencies in calcium had even stronger ways to respond in terms of the tests that their teachers give on attention deficit. So our conclusions were about diet. If kids don't get enough calcium, that may be a problem. But if they're also poor and they live in conditions where there's exposure to lead and manganese, that will also be an exacerbating condition. And sometimes kids have all three together. So we were hypothesizing that the biological basis of attention deficit disorder had to do biologically, but also some of the social environmental issues that. So there are many papers on this kinds of. So if you're looking, just to give an example, pick a disease within the broad range of developmental disabilities. And then. Okay, Tara. All right.
Okay, so we were talking a lot about suicide actually.
Mhm.
And related to my site.
Good.
It's a crisis hotline.
I mean, I don't mean good.
Yeah. It's a crisis hotline.
Yeah.
And they're designed as a competitive outreach measure to help people with suicidal ideations or some form of crisis. And I found an article by the CDC.
You're speaking to your paper.
Oh, sorry.
Okay.
So I found a CDC article related that suicide itself, having many different causes, has no cure and is the 10th leading cause of death in the U.S. And for this reason, preventative measures such as hotlines are employed to provide as many barriers to suicide as possible. And with my current status of research, the epidemiological research, risk factors for suicide include mental illness and SES factors, such as economic well-being. And in terms of environmental health, additionally, suicide affects more people than the victim alone. So the environmental health studies have shown cognitive restructuring, impairment, and relatives to victim after suicide.
Yeah. Serious impact on the social environment.
Yeah, and in terms of health policy and management, they're helping potential suicide victims, though hotlines are affected by the mental health of the caller and the willingness of the caller to use the resources provided by the hotlines. And lastly, the social behavioral aspect, cultural diversity has shown to play a big role in the incidence of suicide, and crisis hotlines should be as versatile as possible to reach out to the diversity of your callers. And that's actually one of my cross-cutting themes, diversity
Yep.
and culture, because it plays a large part, and there should be different approaches for different cultures because the behaviors and what's considered a norm.
Would be very different. And so the recognition of when to intervene will be different.
And in terms of leadership, I think that the National Suicide Prevention Lifeline is one of the main areas of this national line in terms of prevention, providing standards, and would help with accessibility in terms of program planning. So that would be a solution. And with communication informatics, that's what the hotline is about.
Yeah.
Communication.
Absolutely. Okay, so for those who want to think about the leadership as a cross-cutting themes, I think your example is excellent. You know, if an organization takes leadership in a particular disease, that helps tremendously. Sometimes it's an individual, and so you often hear that a Hollywood star or a sports star came out and talked about their suicide attempt. And that focuses attention on the topic, and everybody starts to think, we have to do something about it, the stress level is too high for this. So if you were to think about a Hollywood actor or actress who has taken a leadership, their attention span is always small, but on suicide, does anyone come to mind?
The only person I know suicide was related to the Joker. And I don't know if that would be some sort of celebrity that really cared about him and would want to advocate.
Yeah, I mean, I don't know this person, but you often hear it in, for example, drug and alcohol use. They come out and say, I'm going to. And this past week, I know she was in the movie Chicago. Catherine Zeta-Jones committed herself to a mental hospital with no stigma. She wanted to, she has bipolar disorder. She wanted to make it public. It's not hidden. Everybody knows she has it. And she's a spokesperson for this disease, that it's not, people should not treat it as something so negative. She's still who she is. It's just like any other disease. So by not hiding the fact, I think she's providing great leadership for that aspect of mental disease. Several years ago, Woody Harrelson attempted suicide. And instead of hush-hush, I think he also tried to spin it in a positive way as a way to educate the public about that, in that industry, it's actually not uncommon. And some hide it in the form of drug addiction, and they, maybe deliberately overdose on drugs. But these are all people who are willing to speak out on the topic and provide leadership in different ways that might be as effective. Okay. We will always associate, for example, leadership on alcoholism, and why a lot of well-known people now go to addiction centers, to Betty Ford, the former White House First Lady, married to President Ford. And, because she suffered from addiction and didn't want to hide it, and created a center for recovery. And so you can find several examples. I think in the cases of breast cancer, you all know Suzanne G. Komen Foundation. That name rings a bell because it was somebody who wanted to make sure that that experience is not lost and they were willing to take leadership. All right, so these are examples. I know you're all busy working on this assignment, but if you have any doubts about how to proceed, I hope these examples help you think through some of the topics. Are there any questions about your specific topic that you'd like us to discuss? Anybody? Yeah.
So if we're just having a hard time with our topic, or is it going to be like change it to something else?
I don't know what hard time means.
Or just more of like, let's say you're having difficulty like finding research, like.
It's not possible.
Or like.
It is tons of, look, this government spends billions of dollars on research. Everything's been studied. It's just not possible. But if you're having difficulty finding I mean, this is why we asked Bethany Harris to come. You know, if you go through her scheme of finding literature, you'll find something. What may be the issue is you're not narrowing down the topic enough. So as she said with developmental disabilities, you're not going to find epidemiological data on developmental disabilities. You narrow down to specific keywords. So tell us what your...
I was trying to do like child life specialty and like their effectiveness of healthcare providers, but I feel like with some of the past-coming themes, it's not that there's not enough research, it's just it can kind of overlap where I just don't know if it fits. So I kind of wanted to focus more on like MRSA, the hospital disease, because with child life specialty, like you're always clean, you want to make sure that you're preventing the spread of disease. So I felt like that related still with the practicum. If it relates to your practicum, it's okay. I'm not gonna hold you to a topic just because you did it for the op-ed or for the. But as long as it's clearly related to your practicum work, it's okay. And if you find an easier time finding articles on MRSA, then it's perfectly okay. All right. Any other? Yes.
So, as long as it's related to our practicum, it doesn't have to be our practicum like objectives.
No, it has to be related to their mission. Where are you working? Where's your practicum site? Okay, so what kind of topic will not be related to the zoo's mission?
Sorry. Well, because I think the mission is pretty much its education, but I was just wondering if I could do something more broad, like still talking about animals, but maybe not necessarily education. But if that's not okay.
Well, it has to be public health, and it has to be related to the mission of the zoo. Education at the zoo, let me just tell you, this week, Harvard University announced that they're going to close down their facility for animal research. Why do you think a lot of universities have difficulty? In the UC system, I think only Davis has an animal research facility, and it's gated with, 10-foot walls and barbed wire, because there are people, activists, who think we should not be doing research on animals, right? And why do we do research on animals? Because we hope to find a cure someday to some diseases like diabetes, right? So part of the role of the zoo is to educate the public about the commonality of life on the planet and the relatedness between human anatomy and biology and the animals that we have in the zoo, to generate some kind of compassion with those organisms. But we also use them not just for food, we use them for research. It's a policy thing. Okay, some people think that's okay, some people think it's not okay. Just like some people eat meat, other people don't eat meat. There are people who think we shouldn't even have zoos at all because it's imprisonment. If you think about a topic long enough, you'll always find how it's related to something you're interested in and what the mission of this organization is. So I encourage you to think that way. So it's not that hard. It is hard, but it's not impossible, to find a topic that would be of interest, even if that's not what they do on a daily basis at the zoo. But the whole issue of using animals and educating us about them and finding cures for disease, I think, is very important in public health. Okay, any other questions or concerns about what you write? All right, our guest will be here shortly, but before she comes, so both assignments are due tomorrow in the Dropbox by 11:59 p.m. The abstract should be a comprehensive summary of everything that you've written. A lot of people find it challenging to limit this to 300 words, but that is the goal. That is actually not just for courses. When you write manuscripts for journals that are going to be published, typically this is the word limit. And I just was working with one of my PhD students this week. The PhD dissertation at UCI, the abstract cannot be more than 300 words. And she was nearly crying, actually, because she has 357, and she could not for the life of her figure out how to cut it down further. But we sat down and looked at it, and there are always some extraneous sentences that you can contract, some words that are not really adding much to the meaning. And we were able to get it down to, I think, 298, and she was very happy about that. So sometimes it can consume a whole week just to fit within the margins of word count, but it's a useful exercise. Yes?
It's APA style, right?
All I want is that you're consistent with the citation. In all of the work that you do in public health, if you are in the United States, it's always a good idea to look at the American Public Health Association and their styles and just make that your default. The American Journal of Public Health, they have instruction for authors, they have a way they want references, a way they want the organization. If you just have that in your mailbox somewhere and refer to it. I mean, we're not psychologists, but there's nothing wrong with the APA style. It's just that if you're going to be in public health, use the style that the journal uses. Consistency, however, is where I draw the line. If you use APA style for paragraph 1 and AJPH style for paragraph 2, you're going to have deductions. Okay, consistent. All right. So, thinking about your final assignment, which is now you know your practicum site a little bit. You have worked there for a while, and you are going to be helping them with various opportunities. The next thing will be that you actually propose to get them money in a way that will be useful for them. And that's why we write grants. Okay? It's the common thing to do in any organization, and getting the skills now will be very useful to you in your career. So having said that, somebody who's done this, I'm sure, many, many times, and here to tell us a little bit about, please, Dyan, thank you, about her role. Thank you for the flexibility in your schedule and for willing to do this with us. So we're going to shut this down and continue after you're done. But I just told them that I know, I was thinking you will be there, and so I left a little bit before you. Okay, so thank you so much. So Ms. Dyan Hall is manager of the Work Life and Wellness program here at UC Irvine. Let me go to that page. Okay. And here is their mission. We're just talking about the mission of organizations and how what they're writing should at least fit into that mission. So she has a Bachelor's of Science degree and a Master's of Education in Health Promotion and education from the University of Cincinnati, where she studied exercise science and community health. She worked for 6 years, both as a student and then full-time for the Ohio Resources Network for Safe and Drug-Free Schools and Communities. This is a research arm of the Ohio Department of Education and the Ohio Department of Alcohol and Drug Addiction Services at the University of Cincinnati. Here at UC Irvine, her responsibilities include assisting faculty and staff on work-life concerns, collaborating with other campus departments in developing and coordinating services, and developing policies which benefit employees in managing work-life situations. So please join me to welcome Ms. Hall to our class, and she will tell us. Thank you.
Thank you so much for the great introduction. I love that all my students are working from here in the back corner, but they all at least are sitting together, so they act like they know each other. I've been here at the university for going on 6 years now. I graduated from the University of Cincinnati, so the other UC. There's a lot of the UCs out there. When I came here, everybody was like, UC? I'm like, no, it's not right. So University of Cincinnati, where I did my undergrad and grad work. And grant writing, yes, is a skill. If you have not mastered it yet, it's an art form. It's something you can take years, to do. But once you have the skill, it makes you very, very marketable. A lot of organizations now get their funding from national money, state money, federal money, and that you have to be able to get the money. We have whole departments here at the university that are completely funded off grants. This folder that was being passed out, this is a program that was grant funded. So every time you hear grant funded, they're not joking. A lot of the money doesn't come from our budgets and things like that. So this is a skill that you would definitely, one of the classes I say that I did use a lot. I don't have to use as much anymore, which I love. But when my first job, I worked at the University of Cincinnati for the Ohio Resource Network, which is, like you said, from the Ohio Alcohol and Drug Addiction Services and the Ohio Department of Education, which is a mouthful. But what my job was to do was to get grant money. And so I would get grant money from the state, and then I would have high schools actually apply for grant money to our office so that they could make drug and alcohol prevention program, actually create programs at the high school level throughout the state. Whereas a high school may not have the funds or the ability to get grant money on their own, I was able to get that grant money for them and then make that funds available. That was my first job, my first life. As here at the University of the other UC, University of California, Irvine, I work in human resources. So my population of our program is for faculty and staff. So it's all the people that are here on the campus that are not students. That's who our programs touch. And these are all, so a lot of the students don't know that this program exists because you don't see it directly. It doesn't affect you directly. But we do a lot of programs around work life and wellness. And so my degree and my background, my master's is in education. I have a bachelor's of science. We didn't have public health, but we had health education and health promotions. And so that's where my background is from. Very passionate about prevention. Even though I was on the treatment and drug alcohol addiction side before, I love the prevention and the wellness, and that's really where my passion lies. We have been working with public health students as a practicum location for about 3 years now. It's been quite a while. It's great when I can see some of the students that have gone and graduated or out getting jobs, and I hear back from them. This quarter we have 12. So it's me and 12 students, and that's our team. We have funding for one position, and that's me, and for all the programs that we do. And so our students really are part of the team. They're the front lines creating these programs, helping host the events. They have projects. Each of them are working individually or with each other as a lead on one or multiple projects. They attend every meeting, attend every workshop that we host, whether they're involved in it or not. I always tell them it's a 10-week free trial. You get to try out a job before you actually see if this is something you really want to do. So I throw them in. You want to come to meet with the Director of Hospitality and Dining Services, you're coming. So we give them as much availability as we possibly can to get you really I always tell the students, you're not answering the phones, you're not filing, you're not going to be we did do a mailing last week, so I feel really bad for the students that actually had to help me put together a mailing, but that's the only manual labor, and then we have a fair coming up where they have to get up at 5 a.m. to help pull this event off. But other than that, it's really, really fun. I don't know if you guys have questions. I don't know exactly. I can tell you more about our program, about what we do, what our programs entail. If there's any questions that you have, I'd like to address those first. Yeah.
So what's like a typical program that you do?
A typical program, you name it. We do workshops, so all different types of workshops. We have some targeted towards parents. We have a Health and Fitness Friday workshop series. We do a lot of education, personal development for our faculty and staff. So they might be interested. We do nutrition, we do fitness, we do stress management, and those are our top risks. So I don't know if you guys have done needs assessments or a typical program. When you start a program, you develop something new, you would do a needs assessment and try to find out what your population needs. We have 19,000 employees. We do not do a needs assessment because you would have 19,000 different answers. But what we do see is we get data from our medical plans and also our wellness plan through a health assessment, which is an online questionnaire that employees can fill out. And we see our top 3 risks, and that's what we develop our programs about. So there's in-classroom trainings where people come just like this and the speaker talks on a different topic, and employees come at their lunch hour. They come on their own for their personal own interest, something they are interested in about, whether it's eating more organically and more fruits and vegetables to new CrossFit type workouts that they're not sure about. And we do all different types of things. We do online programs, so there's webinars, same thing function where you're sitting in front of a computer and we're able to watch it. We have online programs for, right now we're doing our Limber Up program, which is we have a series of ups. There's Step Up, Limber Up, Cheer Up, Fuel Up. They're all online-based videos and programs that it's a 10-week behavior change program. Employees sign up. They get incentive for signing up. They go through so many, right now Limber Up is a flexibility and stretching one. So people at their desk can take a quick couple minutes to walk, as a video, they walk you through different stretches that you can do in and around your office. After you've watched 21 videos, it doesn't have to be in the same order, then you can earn incentives. And so we still incentivize our employees for doing and participating in those types of things. We have our big events where we do health screenings. So we partner with our medical plans to do blood pressure, cholesterol. I'll ask my students what blood pressure are, I won't put them on the spot. Blood pressure, cholesterol, body fat, waist-hip ratio, and BMI. So we make those free available to our faculty and staff. And that's the one program that we actually can screen students. Has anybody participated in one of those screenings? No, not yet. We don't really advertise it to students because it is funded by our medical plans, but if students are walking by, we will pull them in. We usually are here in the Student Center, or we're over at ARC. When we do that once a quarter, that people can stop in and get those screenings done for free. So that's just a few that I always try not to overwhelm the students when they walk in, because they look at me like deer in headlights, like, oh my God, that's so much. And that's why for them, I like to just, give them one specific project, and they can get it beginning to end, and they feel like they've accomplished something and have something to show when they leave at the end of 10 weeks. Did you answer another question? Okay. It's as far as positions, I want to talk a little bit too. This is something you're interested in, and a lot of people think about wellness and like, oh, I like that, I like working out, I like nutrition, this is interesting. And with your public health degree, you can definitely go into this field. Wellness is one of those hot button jobs that's coming up more and more. A lot with healthcare reform. I know you've heard a million times about healthcare reform. So confusing to some people, but in the long run is that people are finally seeing, and these companies, which are all about profit and profit and profit, they're seeing that their profit is affected by the health of their employees. So the healthier your employees are, the more productive they are, the less sick days they have, the longer they stay at the company. And then this younger generation, you guys graduating this year, next year, you're ready and you're looking for employment. You want to work at like the Googles, right? And the places that have these work-life balance. I can come wearing whatever I want. I can telecommute. I can make my own hours, and nobody's gonna be looking at my back. Like that's right. Am I a little far off on that? But that's something that is enticing to younger generations. Where our parents and our parents' parents was, what's the pension plan? What's the retirement look like? What are my benefits? Right? And so what we're trying to do is that here at the university, this is relatively new. I've been here for almost 6 years now, and the program didn't exist before I got here. And so we're just in the forefront. A lot of universities have wellness programs for their employees. Almost everyone in the UC system does now. They're not all as extensive as ours are, but we are trying getting on that boat so that a lot of the universities have. outside corporations are picking up that this is something they need to invest on, right? Their healthcare costs are going up. And so how can we keep the healthcare costs down? Therefore, our bottom line is better. Well, if our employees are healthier, then our bottom line for healthcare, they're not going to be on long-term medical coverage and needs for things down the line. And so we're looking at that. A lot of employers are taking drastic steps. Have you heard of some of the companies now that don't hire if you're a smoker? Right, that's legal now, right? If you're a smoker, you can't apply at some places, they won't hire you. Cleveland Clinic, they only let you go past the first question on their job application. There are some employers now that are looking at weight and obesity because they know that the more obese their employee population is, the more they're going to cost them in healthcare. So we're getting on this trend of we want a healthier workforce. So there's some longevity in my field. So if you're interested, that's something I would definitely say. There's all different sides. You can work for a company like I do. So I would say I would do corporate wellness, even though the university is not really a corporation. But a wellness program internally for a company. Large companies all have them, even Google. They have these internal companies that you can work for within the organization. And then you have outside companies. We have some vendors that we work with. There's a company called Staywell that we use in the UC system. But there's outside vendors that they package and they promote wellness programs to smaller companies. Somebody that can't afford to have a full-time person designing programs for them. And so they hire an outside company that provides health screenings, online health assessments, workshops, things like that to their employee population. So there's lots of different areas to go into when you're looking at corporate wellness, corporate health. The benefit side of the house, you're looking at medical, dental, vision, those types of things. So if that's something you're interested in, you can always contact me. I have 12 students, not all of them in this session, but 12 students this quarter in this class. So that's another thing that we can help you with as well. Are there any other specific questions?
I have a question about, so thank you for beginning with the grants. Always getting resources to support the programs. And you have several workshops and activities, and I know that as these kinds of work-life and wellness is being reproduced in other universities, they'll start tracking who's the healthiest workforce. And do you have it, what do you measure to know whether in fact UCI's staff and faculty are getting better?
I love when I get data questions. Grad school and statistics. So with anything that has to do with health and data, and wellness programs, and you might hear, return on investment. For every dollar you spend on prevention, you'll save thousands of dollars. Well, once you do a lot of data, you can start to realize that you can kind of make the data a little bit your way, but depending on what you want to do. So a lot of, I get that there's general benchmarks, and there's benchmarks that are out there that we can show. And we get these benchmarks from some of our vendors. At UCI and at UC system-wide, we don't have a really good benchmark yet. We're working on how, because it is such a new program, they never really directly find that correlation. Because we have a wellness program, is that why our healthcare costs are going down? Is that why we are the safest campus in the UC system? And so our funding actually comes from workers' comp rebate money. So just like car insurance, the university has to pay to have workers' comp insurance for every employee. So just because you make $30,000 a year, the cost of the university is way more than $30,000. There's all these other, just like student fees, right? There's all these other line items that you have to pay, and insurance and taxes, you don't know what they're for. One of the things that goes along with having an employee is paying for their workers' comp insurance. We are self-funded for insurance within the whole UC system, and so that there's a percentage of payroll goes up to Office of the President that then comes back down onto our campus that we can say they give us back money for prevention, basically. So we get a certain amount of money on our campus to prevent injuries from happening. And when I started 6 years ago, the thought was, well, the healthier our employees are, the less they'll be injured. And if they are injured, they'll come back to work faster, right? And that's pretty logical. But now, is our campus the safest because we have one of the largest wellness programs? And can you draw that direct correlation? I don't want to say that. I don't want to speak too highly of myself. It's definitely a fit, and it's definitely part of our overall success in the program. They have not yet in the UC system tied it to medical care costs. We're getting there. A lot of employers already have, a lot of wellness programs are tied to medical insurance. We do have some wellness programs and vendors that are tied to medical insurance. Here at the university, we have 3 options for employees. They can choose Kaiser, Anthem Blue Cross, or Health Net. And each one of those medical insurances that they pay a monthly premium for have a wellness component. They don't pay additional for it, so a lot of employees don't know that they have it, but it is part of their paid medical benefit that they have. And it's for things like smoking cessation or weight management, one-on-one health counseling. So things they can get at that level, and then there's programs that we do here on the campus that are more general that they can also do. But data and benchmarking we don't do a lot of. Right now we look at participation and we look at overall value and motivation of the people who attend our programs. So we do evaluate every program that we have. Like I said, for how many people attend, do we have more and more people participating? Because we're a young program, half the battle is just awareness, right? Getting people to know that these services exist, and getting the spread of mouth and getting people more. Just like students, I don't know that some of my students, I won't call anybody out, not this quarter, but I had one student and I said, we're gonna have to go over our meetings at the ARC this week. Will you meet me over there? I'm like, where's the ARC? Well, what's the ARC? And I'm like, well, huh? This is a senior in public health. I'm like, you've been paying for it for 4 years and you've never been? Did I embarrass anybody? Does anybody not know what the ARC is? Okay. Just nod your head like you know what it is. Yeah, right. Okay, so even if you've never went other than freshman orientation, hopefully it sticks in your mind of where it is. But just like for students, you don't know that every service exists for students. Faculty and staff are the same way. We have, it's engaged. That engagement is about making people feel connected to the place that they work, just as a student. As a student, you can live off campus, park in the parking lot, go to class, get back in your car, and go home, and that's your college experience, versus somebody who is very engaged and involved in clubs and organizations and social networks, and really is a part of that, go to sporting events, own UCI apparel. I'm looking at my students, because I asked them at an event, can you wear a UCI t-shirt? And they're like, well, I don't have a UCI t-shirt. So you're kidding me? So anyway, the same thing with employees. And so we're trying to get them more engaged. We want them to feel, yes, I work at UCI, and that is something that means something, and that they feel engaged, and they want to come to work, and they do more than just drive, walk out of their car, go into work, walk down and go, or spend 20 hours in the lab and then never know what's going on campus, or oblivious to some of the things. So we're increasing awareness, letting people know what these services are, whether or not they even attend. To me, it's a win in my book, just the knowing that this program and these services are available, that the university cares enough about the health of its employee population to offer these services. One thing coming up, you guys will be long graduated at January 1st, smoke-free. Smoke-free UC system-wide. Yay for some, nay for other. I will be careful how well I jump up and down. It's a system-wide policy that's going into place. So system-wide, every UC campus, you might have heard UCLA just went, they were one of the first to go smoke and tobacco-free. All of our medical centers have been smoke-free for at least 5 years. So all the 5 medical centers in the UC system, so we're just going down that line.
It took many years.
It took a lot of years, and it's a big political minefield. The culture of our campus, we have a lot of international students, we have a lot of events that go on here that bring people from all different countries onto our campus, and so that's always been an issue. It really took a system-wide effort to make it say, okay, UC is doing this, and they really, so the chancellors can really grab onto it. Because I think, one wanted to, and then not sure, and you always hear, I always say, very rarely do you get people and championing for a policy that they agree with. It's only when they disagree that you hear things. So there will be, just so you guys know, when you're in the, you'll get a Zot mail coming out probably about next week from the committee with the proposed proposal. So if you have an opinion, the chancellor is really, and the campus is really going to take a public health stance on smoking. And the reason why they really are pushing to go smoke-free is a public health issue. And so that's why I wanted to bring that up to you guys today, because you will be getting a Zot mail and they'll be asking for opinions and feedback on the policy. So good and bad. If you have any opinions on it, please feel free to reply. They're really, really wanting to get some feedback. And I'm on the committee, so we get a lot of negative. So I always say if you have any positive feedback on it from a public health stance, I would definitely suggest that you put your speech out there. Yeah, I hope so. You never know.
So we do actually have UC Online Public Health t-shirts that we give to our students. I don't know why they would say they don't have it. If
Go
you
back.
haven't meet Happy Chef community on occasions, we have them now.
I will let them know that they have those available to them. I give them a hard time, but no, they're great. And like I said, well, the other thing I will mention too, because I am in human resources, if you guys are looking for jobs after you graduate, one of the things that we have internally here is an internal temp service. Our students get a little bit more attention because they're in our office, but they will actually meet with our employment team before they leave me. We work on putting portfolios together. Do you guys know what I'm talking about? When I say portfolios, brag books. If you don't have one, please talk to some of my students. Start working on one. It really makes you stand out when you go to job interviews. A brag book or a portfolio is done in a lot of other fields, not normally done in public health. But you guys have a lot to brag about. If you've been involved in research, if you've been involved in any publications, any jobs that you've had, any events that you've worked through your practicum experience, those are all experiences. You know, you look for jobs, they say 3 to 5 years experience. Right? Well, you have experience. You have grant writing experience right now. So if a job application says grant writing experience, check. You've got this. Okay? So there are things that you can look for and add, but a brag book helps to bring it to the table. Instead of just saying, yes, I've had some grant writing experience. Well, here, now I can show you some of the grants that I've applied to, and here they are. And it's a visual aid for somebody. It really does make you stand out. I get numerous emails from students all the time that have will take the time out of their day after they're, done with an interview and email me saying, I used my brag book and the person interviewing me was so impressed and get jobs because of it. So I will tell you, it's one of my best, kept secrets. And so I wanted to share that with you guys. My students will have them. They're sitting in the back. There's a couple in here today. The rest of them are probably working. But you can definitely, contact me, contact my students if you have any questions on that, or just Google brag books, portfolios. You can find them all the information you need there. We do have a temp service here on campus. So if you're not sure what you want to do, which I get a lot, and that's okay. But the public health degree, it's a blessing and a curse, right? And my students have heard me say this probably more times than they like. Your degree is so, broad that you can do so much with it, which can be a blessing and can be a curse, because some of you sitting in this room probably still have no idea what you want to do with this degree that you have. So start thinking about the things you like to do, degree or not degree. What are those skills? What are those things that you like to do? And that kind of can help guide you. But you have so many job opportunities open to you because of your degree. And so really kind of take that and mold it into what you want it to be. We have an internal temp service here at the university, so if you're still not sure, and you're not sure what you want to do, but you know you need to pay rent, and you're thinking about grad school, and you're in between, and you're searching for jobs, you can apply to be a temp on campus. And so instead of when people go out on maternity leave or they have an extra project here on campus, instead of hiring outside, they go to our internal temp service. So you apply once, you become a temp with the UCI system. You could work here or at the medical center. It's kind of being a substitute teacher. They call you up and, hey, we have a job that we think you'd be a good fit for. Are you interested? When can you start? And it's a temporary position. So if you're interviewing for jobs and you find a full-time job, then you just give your notice to the temp and you go on to the next job. But it's a really good way to build your resume and to get your foot in the door if you're interested in working here at the university. Because a lot of my students that have done that are now still working here because they got hired on full-time. So if you have any other questions about that, let me know. Any questions? Yes?
Where do we go to find out about that?
The temp service? You can go to HR's website. So hr.uci.edu. Any job that you want to apply for, or even if you're not sure what you want to do yet, I would suggest going on and just looking around. So if you go to hr.uci.edu, that's human resources for the whole UCI campus. On the left-hand side, there actually is a link for jobs and employment. And so you just click on that link. It's an online, everything is online. No more do you print off a resume and drop it off in an office. You can go ahead and even now create your online user profile. The temp services is a job that's listed every single month. They only leave it open for about 2 weeks of every month, the beginning of the month, to constantly be checking. You can create your profile. You can already load your resume on there. You have all of your background information. So if a job comes up that you're interested in, they'll actually notify you. You can put in the search criteria, and also if you want to go ahead and apply for a job now, it's a one-button click. You can apply to 5 jobs in 5 seconds. So once you create your online profile, then it's really easy to apply to multiple jobs. Once you apply for the temp services, then they will follow up and contact you. And there's an interview process and then a skills assessment process for that. But once you get into the employment, the temporary services, then you're part of the team and you can be called on at any time. Any other questions?
One more question.
Yeah, yes, please.
So as you are building the awareness of the program, faculty, staff, we were discussing cross-cutting themes in public health. one of the commonly noted things is that women are more likely to do things related to prevention, wellness. Is that what you see in the audience at these workshops?
We do. Well, our university population is predominantly women.
Oh, okay.
Yeah. I don't have the statistics for, but out of the 19,000, I would say we're at least 30% female at the university. If you, not so much on the faculty side, but it's a lot heavier on the staff side with a lot more females. And we see predominantly, there's some workshops that are more male driven, and then we see more coming. But most of it, yes, we see a lot of females, a lot of women coming to our workshops depending on the topic. And utilizing the services can be, pretty broad. But yeah, we do. That's definitely something that we're seeing. And usually they're the caregivers. And not only is our staff population majority females, they're predominantly the caregivers. And so we're starting to see a lot of, work-life balance issues and things. And so we're increasing our programs that we make available as far as work-life balance, flexible work schedules, parenting series, how, resources for parents and new parents. But yeah, a lot of our workshops are targeted to the female population. See that? You guys are too easy. All right, well, if you think of anything else, definitely let me know, or let any of my students know, or Heidi in the back. Yeah.
Well, thank you so
Either way.
much. So you can take the public health blog with you when you go to these places.
Yes.
And
Oh,
don't
thank
forget to
you. Thank you so
students.
much.
We appreciate your taking the time to
Thank you so much. Anytime.
So it is, as we said, the Occupational Health Day in terms of it being May Day. Let's finish. I only have about half an hour, so I know you all want to take a break. But if you want to just stay with me for a few more minutes, we'll be done, and then we can make it a short day. So the agency that deals with work health, occupational health and safety administration, it's part of the U.S. Department of Labor. And so everything that she described, probably voluntary participation by UC Irvine, but the fact that we have to have a program that takes care of injury prevention, health and safety among workers is under this government agency of OSHA, Occupational Safety and Health Administration. In terms of public health, we already covered a lot of ground in today's discussion, but I want to use this also as an example of what we've been discussing under the core and cross-cutting themes of public health, which is on the right-hand side of the framework. In this particular diagram, it's a little different from the one we presented because epidemiology and biostatistics are kind of separated. But based on what you heard her discuss, can you tell me some aspects of the discussion of wellness at UC Irvine and her job that has the epidemiology and statistics aspects? Is there anything she said that made you think about that? Yes?
She's talking about the benchmark.
The benchmarks. How do you measure whether something actually has an impact in reducing disease or illness or injury in the population of workers that are taking that program? That's exactly what she was referring to. How do you collect epidemiological data? And she said UC Irvine has not exactly done that, but we're leaders, but it's just because it's new. But they will eventually have to justify all the money, $6.2 million to produce this and all the workshops. We want to know that it's making a difference. The way to do that is to get what she said, the baseline. They did a needs assessment, and now they have to know whether their programs actually fulfill those needs. All right, what about social and behavioral sciences? Is there anything that she said that made you think about? Anybody? What was my last question to her? You remember the question I asked her? Nobody remembers it? Yeah, you remember it.
The female male.
Yeah, the female male. And she said something important that not just that females are overrepresented, but that they're the caregivers, right? So we have social norms for gender in public health. It's not just in wellness, it's in every aspect. Men are less likely to go seek care, to go do screening, to go to workshops. That's part of the challenges of public health, is that at least in this society and most parts of the world, women are more likely to be assigned the role and responsibility of caring for the health of the family. That's a social issue, it's behavioral. It doesn't mean every family is like that, but in most cases, that's just the way it is. Which may mean that when you're in the cross-cutting theme of communication, the follow-up question that I would have asked her is, do you do anything to particularly target men to come to these workshops? Because that would be the challenge. That would be one of the things you need to do to make sure that your activities are actually distributed more evenly. All right, what about health policy and management? Anything she said that made you think of that core area? Yeah.
You have the smoking.
Big policy controversy, right? And we couldn't do it by ourselves at UC Irvine. And so we had to get all of the UC campuses together to think about the issue, and the Office of the President in January 1st, 2014 will issue UC is smoke-free university, which means the policy will trickle down to all of the campuses. A smoke-free environment is a huge thing for wellness, because now we in the University of California produce the research that said that secondhand tobacco smoke is bad for us. And that's been more than 20 years since we've known that. And yet we've tolerated smoking on campuses, partly because of the controversies that she described. You could say the same thing about the environmental health sciences. The people who discovered the impact of secondhand smoke primarily at the UC Berkeley School of Public Health many, many years ago. It's led to many policy changes, no smoking on airplanes. It wasn't because there was any risk of fire. It was mostly because people sitting behind you, ahead of you, were all exposed to smoke. And the research was increasing lung cancer incidence among the air stewardesses who were surveyed and evaluated because they were being exposed to so many different chemicals, including secondhand tobacco. Let's think about some of these cross-cutting themes. In my view, she talked a lot about leadership and professionalism, but if I were to pick four, probably program planning defines a lot of what she does, right? I mean, every workshop, every proposal she writes, it's really about program planning. Communication and informatics, very apparent. And she's an N of one. I mean, she's essentially leading this program with student support. Thank you to public health students. But she had to be the leader on campus for this. The position was created, and she started as the founding staff member for that particular position. We could have asked her more about her leadership skills and how those may or may not have challenged her. But since we didn't ask her, I'm going to ask, is Jeffrey here?
Yes.
Okay. So what did she tell you about her leadership skills and challenges when you interviewed her?
Well, she talked about the biggest challenge to the organization as a whole, which is awareness, which he kind of went over.
Right. Participation and awareness.
Yes. And she said since the wellness program is still relatively new here at UCI, they had to build everything from the ground up since they're they've only been here for 6 years or so. So everything they're doing is brand new, and there's a lot of employees that don't know like what's available to them and stuff. Yeah.
Okay. Paige, did you add anything else?
So the major challenges of this is just like adding new programs throughout the year because most people don't like changes. So just getting out there and letting people know about it is the first step.
Okay, thank you. So let's hear from others who may have interviewed their supervisors. Breen? Yeah. Did I say that correctly, Brian?
Breen?
Breen.
Yeah. Okay, so I interned at Small Solutions, the dentist's office. So I interviewed the dentist, Dr. Kim Kazum, and he told me after he graduated from dental school at UCLA, he worked for 6 years at a clinic providing dental care to more like low-income communities. And then he opened up his own practice. And he said one of the biggest issues he has with patients when they come in is they have like a preconceived notion of how a dentist's office is and like how a dentist appointment is. So his biggest thing is like education, like thoroughly explaining each procedure he's going to do, what's wrong with or what issues they might have, and telling them like how they can prevent it from happening in the future.
So
and
the myth, to demystify the whole process for them.
And then he was saying like a lot of times like patient retention could be difficult because they don't have insurance to pay for it. So he really emphasizes like working with the patients to see like alternate payment methods and like payment programs so they can continue to have good care.
Good, thank you. Sarah?
Yeah, so I intern at the Bakery Science Center. So I mean, one of the major challenges that they have is since it's like there's also an educational aspect to it, it's finding a lot of, because they're actually understaffed there, and so having people to teach these programs, because they do it into little sections, and to have enough people to coordinate and work out with these is an issue, because they actually have, one of the guys that volunteers there basically works there, but he's been volunteer for about 10 years, and he knows a lot about with the facility and what he's doing and stuff, but it's also very like, if they do have volunteers, you know, they can always back out because they're not very committed to it, so I think that's also a problem, and then just a matter of getting new materials for these programs.
Are they funded only by the state, or do they write their own grants and get?
They're mostly funded by the state, and then they do get grants. But then again, there's restrictions to like where the money can go towards, and all those.
Because they can't take money from some commercial that wants to develop the land. Okay. All right. Thank you. So that's an important. Way to transition to grants. As Ms. Dyan Hall said, a lot of the work is raising funds and justifying what you use those funds for. So as you begin to think about the draft grant proposals that's due on May 16th, you're welcome to discuss with your preceptors, like with Dyan Hall, you know, what kind of grants would benefit this wellness program? Are there agencies we can target to generate funds? In public health, the government agency that funds most of our work, but primarily research, is the National Institute of Health, NIH. And I have links here to all of their programs. It's a thick booklet that they publish. But you don't have to write grants just about research. You can write about implementation of a program. It may be that you want to develop a workshop training program that you use to encourage people to do healthy behavior on any kind of disease. So it could be program implementation, it could be research, it could be a fellowship to help you conduct research in a university. The US EPA fellowships, it's an example. This is actually at the level that we are now. So seniors in high schools typically write these grants. They're going to graduate school, typically get their master's or Ph.D., and they say, I'd like to work on this particular topic because it's a major public health problem, associated with environmental health. And when they are funded, they can take, it's about $37,000 a year for 4 to 5 years that they can take with them to any university to do that research. So some students have actually submitted the proposals that they've written in class, in this class, either to the Practicum site where they will use it to actually get funds. Others have used it to try and get fellowships. And some foundations, private foundations, have also been targeted as sources of opportunity. So just to take the example of the NIH, there are so many centers, and it's not possible to do public health practicum and not find a public health, an NIH branch that focuses on the kind of work that fits the mission of your site. Okay? So whether it's cancer, international stuff, complementary and alternative medicine, minority health, National Eye Institute, cardiovascular disease, heart, lung, and blood, genetics, aging, drug abuse, allergies, arthritis, you will find something relevant to what your site is. Environmental health, mental health, nursing, library of medicine does educational issues in health. So it's a lot of opportunities to do, to write and get money, to write a grant that's worthy, that everybody understands and has priority. So I'm going to be calling on some of you over the next few classes to kind of tell me, you don't have to submit anything, but you should pay attention to these questions. I want you to know NIH a little bit more before you graduate. Think about the mission of your agency. Think about what part of NIH may support work in that topic. What are the goals of that NIH branch, and what types of grants have they supported in the past, and what are their priority areas? This is very easy. All it takes is to click on, to cut and paste any of this into Google, and you go to the website of that NIH branch. Okay? And that all of this information will be there. So if you type in National Cancer Institute, it takes you to their website. They will have information on the goals, the grants that they fund, and their priority areas. Okay? It's just a way for you to get to know if you ever get into public health research, most of your activities will be focused on writing grants to the NIH. If you don't want to do NIH, just tell me what other agency it could be. One of these, if you click on the public health partners, you'll see there are so many organizations that give grants in public health for children and families, healthcare research and quality, tropical medicine and hygiene, on and on and on. So many. Bill and Melinda Gates Foundation. You could answer the same question for all of them. So next week, I want you to have this information ready. I may or may not call on you, but I want you to have it ready. Okay. Oops. All right. So very briefly, the assignment, you already are familiar with writing abstracts. For the grant proposal, the abstract could be a little longer, 500 words. It's a summary of the entire project, including the significance of the public health issue, the main methods, the time period, and the budget. So, nothing such as I'm going to cure cancer in 5 years with $10. It's not possible. You're not going to be funded, even though it's $10. But that's essentially, what I just said, just miss the method. How are you going to do it? But if you say, I'm going to reduce the incidence of depression among UCI students by creating a workshop program and implement it over a 2-3 year period with a budget of $100,000. Okay. That's the kind of information that you put in an abstract, because depression affects 15% of the population. It's an unacceptable public health problem, and we're going to do something about it. Okay. Create a workshop program, implement it over a time period, and tell us how much it costs. The statement of need is important. It's kind of like why this project is necessary. This is where you go into a lot of the epidemiology of whatever disease or condition that your topic focuses on. It could be an educational mission, but what are you trying to educate against? Why the problem persists despite all of the things we know about it and the attempts to solve that problem. So here you will begin to need a lot of references cited to support your claims. And then you describe, this is the main part of all applications. What exactly are you going to do? How will you do it? So this is the detail about the project and how you will implement it and how you will evaluate whether it works or not. Are you going to survey people? Are human subjects involved? Is this on campus, off campus, at the public health site, Orange County, nationally? What's the sample size? Think about statistics of sampling and then the methods that you will use. Again, with support with references and citations. I want you to think about budget. How much things cost is very important in public health. You don't have to be absolutely accurate, but I want you to think about paying yourself, for example. It's always part of the budget. I mean, nobody works for free, and it's in most places, it's the biggest part of the budget. If you're buying equipment or printing flyers, estimate the cost and add it. This can be presented in a table format. It doesn't have to be a narrative. Just put in a table with categories and cost estimates. And then write about the organization that's actually going to implement the project. In most cases, this could be your practicum site. Okay, so you're writing on behalf of your practicum site. You want to implement a program or a project, do research on a topic, and you want to convince the funding agency that you have the facility and the people to carry out the project. It's about 250 words. And then the conclusion, the summary of the proposal's main points, who will benefit, after the project is complete. We would have reduced, for example, depression at UCI from 18% to 5%. That's a good goal. How would you measure that? Maybe annual surveys, clinical surveys of depression will make that possible. Again, 250 words. You should try, in terms of program management, a timeline, again in a table. I'm going to do this in year 1, this in year 2, year 3, and how you will proceed across the tasks over time. Because it helps you think through how long things take, how much effort and energy and money you need to proceed from one task to another. And then references. I don't count references in the word limit. This assignment is 4,000 words, and references are not included. I would also like to see at least 20 scholarly references, as we have for the scholarly review. Okay. Are there any questions about this assignment? We'll talk about it more as we proceed. For now, for tomorrow, all you need is the abstract and the scholarly review, submit the drafts. For this one, we still have some time, but I wanted you to start thinking about it.